How many of you are just as frustrated as I am about the state of healthcare, especially here in the US? You go to a doctor, you try to figure out what's going wrong with you, and you get a kind of a sanctimonious answer, if any answer at all. They want to rack up a bill, run a bunch of tests that aren't necessary or aren't helpful, and then you walk out of there with a fistful of pills that don't really address the reason as to why you're sick. If you're super frustrated, stay with me tonight. We're going to be talking about that and how to properly navigate the healthcare arena and finding a fantastic doctor who has the opposite philosophy, a philosophy of root cause resolution versus symptom suppression through pharmacy. We'll be right back. Stay tuned. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's zone. Welcome to Dr. Osborne's zone. Recently, I was advocating for a family member of mine. We had a medical emergency in our family, and so I was called to come and sit in with a family member as they were at the emergency room in the hospital. And in this particular incident, there was no trauma. It was a case where she was being over-medicated with a hodgepodge batter of different medicines that her primary care doctor wasn't overseeing very well, and the list just kept getting longer, but then these drugs started to create an interaction. And anyway, what it ultimately led up to was my family member ended up passing out because the drugs were affecting her blood sugar so extensively that she ended up in the hospital as a result. So anyway, here I am. I'm called into this situation. I'm sitting in the room, in the exam room with this family member. And the first person that comes into the room is a technician. Nothing wrong with technicians, but the technician is coming in with a wheelchair to take my family member off to do a CT scan of the brain. And I'm like, oh, wait a second. Why are we going to do a CT scan of the brain? First of all, there's no indication of trauma. There's no indication of brain injury. There's no indication that there's a problem with the brain. So why are we going to spend $20,000 of insurance companies' money performing a CAT scan in an emergency situation? That doesn't make any sense. The doctor hasn't even been in yet. There's been no examination. There's been no communication. Nobody's come in and talked to this family member of mine. They just automatically, standard of care, want to run a CAT scan. So I run that tech off. About 20 minutes later, a physician assistant comes in and tries to scare me, because again, I'm advocating for this family member, tries to scare me into thinking that we need this CAT scan for the brain. And I'm like, well, what are your differential diagnoses? What did you actually talk to this patient about that makes you think that a CAT scan is necessary? Because nobody's talked to the patient yet, and the forms we filled out show no indication of trauma or injury. So again, what we would like is some intelligent conversation before we just run a bunch of medical procedures that aren't necessary, but also that don't come, or procedures that aren't potentially going to radiate this person unnecessarily. Because CAT scans, frankly, are full of a lot of radiation, and that doesn't come without side effects. So the PA leaves, and then the doctor comes in. Finally, we get somewhere. We get a doctor. This is after about 2 hours in an emergency room setting. They're making us wait after they made us feel like it was so important to get that CAT scan right away. So now we're waiting. It's 2 hours in. We get a doctor that finally comes into the room. And so I'm watching. He comes in and says, I'm going to perform an examination. So he proceeds to perform a neurological examination, something I am extremely well versed in my background. So I'm just observing this doctor perform a neurological examination on my family member, and he's doing it wrong. He's doing some of the procedures incorrectly. He's going about it in the wrong way. And so it's very obvious to me that this doctor lacks competency in properly performing a neurological physical exam on a patient. So now I'm even more concerned because now we have somebody who doesn't know what they're doing, who's trying to call the shots and make the decision. So performs the exam and then tries once again to push the CAT scan. And so I end up at this point putting my foot down saying, look, we're not doing a CAT scan. There's no trauma. There's no differential diagnosis of stroke. The neurological exam, albeit it wasn't done super well, was normal for all intents and purposes, not showing any signs of stroke. So there's no real reason to look at a CAT scan to try to rule anything out. Why don't we have a conversation before we rack up a bunch of medical procedures that aren't necessary and cause radiation, undue radiation to this patient? So now, at this point, because I'm advocating for this person I care about, we're now enemies of this hospital emergency room. Not enemies because we're demanding something. We're enemies because we're just asking for adequate care and for a conversation and for some damn attention to detail, right? And so you could imagine, how many of you been in a situation like this where you're in that type of situation and doctors are not paying attention, there's no attention to detail, and you're just being run around and nobody's sitting down and explaining anything to you. If you can empathize with that type of situation, chime in the comments below. Anyway, to make a long story short, we ended up getting out of that ER room with an IV bag. They ended up doing IV fluids. And had I not intervened, we would have had a CAT scan and probably multiple other procedures that just weren't necessary, because if the doctors had cared to do good patient history taking and a good examination, they could have gotten all the information they needed from a simple conversation and helped us get out the door. But that just wasn't how it went down. And so all that being said, I know if I'm experiencing it in my family and in my life that you must be as well. And so the next question is, how do we avoid situations like that? Or how do we make different decisions so that we can find the best types of doctors and not have to go through situations that are ultimately extremely expensive, extremely frustrating, and don't get you anywhere, right? So that's what we're going to talk about tonight. Before we dive into that, I just want to talk about numbers, about raw numbers. As we look at, if we're going to make constructive criticisms about medicine, look, and I'm a fan of medicine. I don't think medicine is bad or evil per se, but I think it's time to have some logical conversation around constructive criticisms of it. And so what you're seeing here is healthcare expenditures. Now, these numbers are United States, and this is in 2023, but in 2023, we spent $4.7 trillion. That's 1 year. Okay, now by 2031, we're expecting that number to be as high as $7.2 trillion, an increase on average of 5.5% per year. That's a tremendous expense, especially when you consider what we're paying for and what it's getting us. Now, if we look at some additional numbers, you can see here, this is medicine by the numbers. So this is $1,432. This is the average spent per American for prescription drugs. So this is just the prescription drug bill per person in the United States in 2021. If we're talking about quantitatively, that's $378 billion spent on prescription drugs in the US. And India was the source for nearly half of all the ingredients used in US prescription drugs. Now, India, no offense if you're from India, no offense if you live in India, no offense if you're Indian, but India doesn't have the same set of standards as the US and Europe. And as a matter of fact, there was a major expose about this written about the drugs that were coming from India and China being not what they're supposed to be, meaning the drugs themselves didn't contain the accurate dosing or didn't contain the drug at all. If you're interested in this book expose, it was written, it's called Bottle of lies. And I highly recommend any of you trying to improve your access to healthcare understands the information from this book. Bottle of Lies, it's an expose on the generic drugs coming out of India and coming out of China, and how it's very misleading, and these drugs that are supposedly saving us money are actually causing us to expend more money because the drugs are not actually effective and not doing their job the way that they should. So we spend $378 billion in the US just on prescription medications. And if we compare this to other countries, this is healthcare spending in the US versus the rest of the world. These are in dollar amounts, and you can see here we've got two types of expenses. We've got, in the dark blue, we've got government or compulsory plus voluntary spending, and then in the kind of light green color, we've got household out-of-pocket expenditures. So that you can see these are some of the top industrialized countries, you know, Korea, New Zealand, Japan, UK, Australia, France, Canada, Sweden, Netherlands, Norway, Switzerland, Germany, and the US. And you can see here in the US, we got $10,687 of expenditures. And again, this is per capita on health expenditures. So the US almost doubles the expenditure of the second closest country, which is Germany. So we're spending twice as much money and in many cases much more than twice, in some cases 3 times as much money than other countries. If we look at a kind of a breakdown of where some of this money is going, and this is money on prescription medications, you can see here, for every $100 that gets spent, 41 of those dollars goes to drug manufacturers, 19 of those dollars goes to insurers, 17 goes to production costs, 15 goes to pharmacies, and then $5 goes to what are called pharmacy benefit managers, and then $2 goes to wholesalers. So it's broken down that way so that you can see who's really driving the vast majority of the profit. And generally, that's manufacturers. And manufacturers are double dipping, because manufacturers, that's their production cost, but then they're profiting that 41 out of every 100. And I'm not opposed to people making a profit, but a profit needs to be precedented on an outcome that's actually beneficial. So if we look at that's expenditure. So we're spending that much money, and here is where it's landing us. In other words, this is what it's getting us. When we spend over $4 trillion a year, you would expect the more money that we spend for quality health care, the better care we would be receiving and the better outcomes that we would have. Well, here's life expectancy of the US versus the rest of the world. In these major countries, we're ranked last, right? So US average life expectancy 77, Japan is almost 85, Sweden 83, France 82.5, Canada 81.7, Germany 80.9, and the UK 80.4. So we are living 3 years or less than the next country. So we rank for life expectancy. If we're talking about in the world, we rank 60th. We spend more than anyone, by far, by double, but we rank 60th in life expectancy. So our healthcare bill is not reflected in our longevity, and that's part of the problem. What are we getting? What's the value in the money that we're getting for? And if we look at, you know, some of these other issues, we look at who's manufacturing our medications predominantly. This is just kind of a little snapshot. This is by no means is this inclusive of all the potential legalities and lawsuits and things, but just a snapshot. Pfizer agrees to pay $93 million to settle a Lipitor antitrust lawsuit. Kansas Attorney General accuses Pfizer of misrepresenting COVID vaccine, hiding safety risks. Novartis faced new lawsuit over HeLa cell misuse claims. Lawsuit could challenge trust in Ozempic and other popular weight loss drugs. GSK, that's GlaxoSmithKline, knew about Zantac cancer risks. attorney tells jury in first trial. Profits over patients. Philly DA goes after insulin makers and distributors on price fixing and collusion allegations. Pfizer agrees to settle over 10,000 lawsuits linking Zantac to cancer. Pharma giant GSK plunges 9% after U.S. court allows scientific testimony in lawsuits. How Big Pharma is fighting Biden's diagram to lower seniors' drug costs. Again, we have these, and then you take into consideration the Purdue payout. It was a $1 billion settlement for lying to the U.S. population and addicting people to pain medications and opiates. And then we have other cases like Merck's case where thousands of people, I think it was over 60,000 people, had died from heart attacks due to false or misrepresentation of drug claims and drug treatment abilities. And so we have a long list of drug companies being taken to court and sued and either making payouts or losing because they're lying about their drug, they're lying about its efficacy or how it works, they're lying about its side effects, or they're lying about the medical treatments that it's actually capable of performing, or misleading the public. And so we have this as, this is a kind of a big thorn in the pharmaceutical industry. Then we have, we have other things. We have this CDC director, Thomas Frieden, this is the past director of the CDC, again, talking about opiates. We know of no other medication routinely used for a non-fatal condition that kills patients so frequently. We hope to see fewer deaths from opiates. That's the bottom line. These are really dangerous medications that carry the risk of addiction and death. Now, this was after Purdue Pharma pulled a fast one over the entire nation, over a battery of doctors basically pushing illicit pain medications to treat people's pain and getting people addicted, knowing that the drug was addicting. The companies decided to do it anyway. The doctors decided to recommend it anyway. And then we look on top of that, we have research coming out of major peer-reviewed journals showing that medical error is the third leading cause of death in the U.S. So here we're paying, remember how we started this conversation is we're paying $4.7 trillion for healthcare expenses to treat diseases like heart disease and cancer and stroke and asthma, etc. Yet, in this expenditure, and a lot of this money, as I showed you, hundreds of billions of dollars of this money are going to prescription drugs. If we look at how do we treat things like cancer and heart disease, how do we treat autoimmune disease, how do we treat obesity and diabetes, or metabolic syndrome or bone loss, we use medications. And with that being said, medication error is the third leading cause of death. So we're spending $4.7 trillion a year to create the third leading cause of death of citizens of the United States. I mean, the system is obviously very broken. Now, I'm not talking about acute care medicine where you have trauma, where you're in a car accident or you fracture a bone and you need, surgical intervention or you need urgency care. There are a lot of lives that do get saved, and I don't want to take credit away from the system that's accomplished that. But when we're talking about chronic degenerative diseases, I like to call them diseases of choice, and you'll learn more about why I like to call them diseases of choice here momentarily. But for those types of diseases, people seek out their doctor's attention and efforts, but the doctor's attention and efforts lead to 251,000 deaths per year. That's the third leading cause of death. And when I say medical error, understand with this paper, what they talked about in this research study wasn't mistakes in terms of I gave the patients the wrong medicines or we operated on the wrong side. These are medical errors in terms of patients being actually hurt by the right medicines. In this country, we have something called polypharmacy. Polypharmacy means you're being prescribed more than one medication. Now, what you have to understand about drug research is that drugs are never studied under the auspice of multiple medications being prescribed simultaneously. Drugs are studied in single disease, single drug use research studies. So that, you may take 10,000 people and they all have X disease and you give them Y drug. But they're not taking, in these research studies, they're not taking people with 3 or 4 or 5 chronic diseases and then putting them on 3, 4, 5, 6 different medications and measuring those outcomes. Because if they measured those outcomes, the research studies would never pass muster because those outcomes are horrible. That's what we're seeing here, is that polypharmacy is predominantly leading to excessive deaths from what they're calling medical error. And that's a problem. And we're spending $4.7 trillion to achieve medicine as the third leading cause of death. That doesn't make a whole lot of sense. Why would we keep justifying this expense? It's a massive beast and it needs to be reevaluated. But if we're going to reevaluate it, we've got to have the ability to talk about it. And so that's what we're doing today. Now, if we look at some of the reasons why medicines can create such a problem, I just want to show you. This is a copy of a medical textbook written by pharmacists for doctors. And the name of the book is Drug-Induced Nutrient Depletion Handbook. Now, there are several other medical texts written on the same topic. But how many times have you had a conversation with your doctor when they're writing a prescription drug or writing you a prescription for an illness where they've said, be careful, this medication can deplete your magnesium, or be careful, this medication can deplete B vitamins or CoQ10. If you've had that conversation with the doctor, I'd love to hear from you below. If you haven't, I'd also love to hear from you below. I'd really like to tally how many of you are having this conversation with your doctor. How many doctors actually take the time out of their schedule to discuss it? Now, I want to illustrate something for you. Because I think if you understand this is a breakdown of how our system currently works. If you understand how it's broken, then now we can begin meaningful dialogue about how to fix it. Again, without trying to criminalize doctors, because I think a lot of people look at their doctors, especially after the last many years, and there's a distrust, a tremendous distrust out there for patients between doctors and hospitals. And rightly so. I think there have been some things that have happened that have created that distrust, but I don't think all doctors are bad by any stretch. So this triangle represents the current state of medicine. So you have the patient at the core, you have doctors as part of the outer ring of this triangle. You have big pharma/agra, so this is agriculture and pharma because they're basically owned by the same companies. And then this final wall of the triangle is government. And so if we look at, again, this is the state of healthcare. Let me describe it. So the government makes policies that influence patient decisions. Doctors have procedures in hospitals. We could say doctors in hospitals have procedures or standards of care that influence patient decision making. And then big pharma, advertise directly to the consumer. Their ads are the #1 revenue resource for news media in the United States. And so they have a tremendous influence on patient behavior and patient choices. That's why they throw so much money at advertising dollars, because big pharma knows that they're going to influence patient decision making as a result of being in front of them nonstop on news channels. So you've got these 3 main driving forces influencing patient decision making, right? Because patients, at the end of the day, patients aren't doctors. The average person is not a doctor and doesn't know physiology or anatomy, etc., and they're not really versed in these things. And so they have to rely on predominantly these 3 influences to be able to try to come to intelligent decisions, right? So if we're saying these 3 influence patient decisions. Because at the end of the day, it's very important that you understand that what the government, what pharma, and what doctors say are all just feedback for you to assess intelligently so that you can make the best decision possible for yourself. And that none of these agencies or industries should be making the decision for you. You should never outsource your healthcare decisions to these groups. You should always be the one making the final determinant decision based on as much information as you can gather and collect about your situation. But unfortunately, what we have here, so we got the government, we've got big pharma, and we've got doctors and hospitals. One of the things that's happened in this arena with doctors and hospitals is it's been corporatized. Meaning that big publicly traded companies have come in and they bought out private practices and they've bought out hospital systems and they've instilled standards that are not designed to improve patient outcomes. These standards are designed to increase revenue. Why are corporations in business? Predominantly they're in business to drive profits and to have return on investment. And this is one of the conflicts when you allow a corporatization of doctors and hospitals. It's very, very hard nowadays to find doctors who are actually in a private practice and where that practice is owned by the doctor and not owned by a massive corporation that, again, creates standards with the primary driver of increasing revenue. And I'm not saying that all corporatized hospital systems don't care about patient outcomes, but what I'm saying is they're prioritizing increasing revenue over patient outcomes. And that's very clear and obvious based on the facts and statistics I've already shown you. We spend $4.7 trillion a year, and medicine is the third leading cause of death. We definitely have a flaw and a breakdown in our system. Now, beyond that, we have, big pharma and big agri. So big agri grows the food. We could call it food. Let's not call it food. Let's call it food because frankenfood, because the food itself isn't really technically food. It's a lot of things that have had genetic manipulation, and that there is a tremendous amount of chemicals that get added to our food or sprayed directly on our food. These are chemicals that the applicators, the farmers themselves that are applying the chemicals are wearing gas masks and protective wear to prevent themselves from being injured by the chemicals they're spraying on our food that we're going to be eating and that we're going to be feeding our children, right? And so you get genetically modified organisms, you get chemicals that are being added, and then when that food goes to factories, which are owned by corporations, you now process that food, stripping away more of its nutritional value, adding flavor agents, adding texturizing agents, adding palatability agents, adding chemicals like caffeine to increase addictability of junk food, etc. So you have agri that's responsible for doing this, right? But then you have agri also communicates and pays doctors to say that this is safe, right? So there's a kind of a coordination between the doctors, and it's not always just medical doctors either. Doctors could also be PhDs, doctors that have higher level degrees in science that are basically paid shills to say, yeah, this stuff is safe. It's not killing people immediately when they eat it. And so therefore, everyone should eat it and it's safe for everyone. Even though as we look at processed food and we look at food grown with these chemicals over the past, really since the early 1990s, we look at the tremendous trajectory of diseases and expenditure on diseases. Again, diseases that we could otherwise prevent as a result of these behaviors. So we've got big agri paying doctors to talk about how safe their chemically loaded foods are, because they're also owned by these similar corporations that their priorities are a revenue, not not outcomes of health. And then you have big pharma as well. When we know the industry is influenced by big pharma tremendously, we know, and there have been a number of research studies and publications showing this actually to be fact, that pharma spends a lot of money in doctors' offices and in hospitals influencing decision-making of how drug prescriptions and treatments are rendered. We also know that big pharma and big agri have a relationship with government. And this relationship can be very easily seen at the CDC directly. The CDC, a lot of the directors of the CDC, when they're done working for the government, are hired by big pharma and given these big, cushy, multi-million-dollar paycheck jobs after working for the government, and vice versa. Some of the people that run big pharmacy companies actually go into the government and start working for the government. Well, the point of the government is to regulate big pharma, right? That's the purpose, is to regulate business from taking advantage of consumers to make sure that these things are safe. But what's happened is there's a communication, if you will, between government and big pharma, or a relationship that doesn't put the patient first. It puts profits first. And so there's what we would call regulatory capture. The very government that we have elected to protect us from things that can go wrong here is actually been infiltrated by this industry. And so the people in the government that run that agency are really just, it's a revolving door between these two entities. And so we get manipulation, we get lies, we get misinformation and disinformation, and we get policies around health that aren't very helpful and can end up harming the patient. And again, all of these industries are influencing the patient's ability to make a decision. Because when you have the government in bed with big pharma and big agri, and you have big pharma over-influencing autonomous doctor decision-making, and you have the same corporations that own a lot of this are now buying out the hospitals. The purpose here, what I'm trying to get at, is you have this massive complex of a system that's been monopolized. You have a monopoly, a healthcare monopoly, where everyone's doing it wrong. The outcomes are horrible, but the cost and the expense is extremely profitable. And who's winning? When the profits are this high, well, these guys are huge winners. These guys are huge winners because they've been corporatized and they've been bought out. And so again, they're prioritizing revenue. And even the government is a big winner. And the government's a big winner because they're getting paid as well. There's tremendous amount of revenue that goes into the government agencies that are supposed to regulate and control bad behaviors of these companies. But the number one source of revenue to the government regulatory agencies actually comes from the agencies, or from the companies that they're supposed to regulate. So we have this really backward system where there's a coercion or a manipulation amongst these three groups influencing patient decisions. And the average person that's sitting in the middle of all this, they think, oh, the government, they're regulating things, they're doing it right. There's just no way that we're paying this big, huge government industries or entities like the CDC and the FDA, and they're doing it wrong. Big pharma is, for all intents and purposes, not evil. They can't possibly be evil. They're out there trying to make medicines that save lives. And of course, doctors aren't evil. They're out there trying to use those medicines to save lives. And I would agree that this should be what the patient should think. In an ideal world where profit wasn't the primary motive, it would be an accurate way to go about looking at this. But the reality is, it's not how it is. But the patients typically don't know better. So they're making decisions from feedback from government entities that are being paid by pharma, and from doctors that are also being influenced by pharma, and medical schools are being influenced by pharma. So it's just a big circle of frustration, because when you're trying to make the decision from this undue influence, it's hard to come to the truth. And this is where I found myself when I was advocating for a family member in the hospital, was that how do I get to the truth when the doctor won't do a proper exam and the doctor won't have proper communication and the doctor is not doing their job, but it's not necessarily even that it's the doctor, it's the hospital policy, right? And that's all been influenced here. But it's also been influenced by government agencies because government produces regulatory boards that control, to a large extent, the behavior of these organizations. And so government, in my opinion, is not really doing a fantastic job because we have all these statistics. As I've shown you, the U.S. ranks 60th in life expectancy. The third leading cause of death in the U.S. is medical treatment. Not improper treatment, just treatment, because it's the standard of care. We spend $378 billion in the U.S. on prescriptions alone, but ultimately this whole thing costs $4.7 trillion. This is a $4.7 trillion industry that is the third leading cause of death, and we're ranked 60th in life expectancy. And if you can't see that that's a problem, I don't know what else I could show you or what else I could tell you. But that's where we're at. And if we don't start with that fundamental truth, then nobody is ever going to have an intelligent conversation about how do we need to go about changing it. So all that being said, I want to talk a little bit now about what I feel like is the solution to the problem. The solution's not in the government. The government's not going to create a stellar tracking system that makes all of this better. Pharmacy certainly isn't going to do it. Big Agra's not going to do it because they're raking in profits, trillions of dollars in profit off of this broken system. So there's no incentivization for the system to change. And of course, doctors and hospitals, I know doctors, many of them are frustrated and they're leaving medicine. They're walking away because they can't work in a system that doesn't allow them the autonomy to be able to make intelligent decisions about the care of their patients. And there's too much pressure and coercion from corporations who are buying out their practices and buying out these hospitals. And so what we're left with is the people that stay in medicine are most likely going to either be technicians or they're going to be mediocre. They're not going to be the best of the best. They're going to be the people that stuck around to make the paycheck. Now, how many of you, raise your hand, if you want to go to a doctor whose thought is, I'm a doctor because I want to make a lot of money? Or would you rather go to a doctor whose purpose in being in that career field is to help people get better? And I know there's a ton of doctors out there that that's what they want, but they're working against a megalithic system that's designed to fail and scrape off as much money from us as possible, regardless of outcomes. And right now, the outcomes are poor. So this diagram is something that I want you to understand a little bit, because it's this diagram where I believe philosophically we can bring about this change. And the change has to come from you. It has to come from your knowledge and your education and your ability to make better decisions. So let's put framing around this diagram. So at the core of this diagram is your genetic code, your DNA, if you will. Now, many of you have been told by your doctor that your DNA is cursed. In essence, what we've been told is that you have bad genes and that your disease is related to family history. And we know that this is wrong. We are absolutely certain that this is wrong. When it comes to the genetic code, you have an influence that many experts believe is worth about 20%. If we're giving it a grade, let's call your health a grade of 100% maximum points. 20% comes from your genetics. 80% of your outcomes comes from your choices. And so what I was saying earlier is, modern diseases are diseases of choice. And so if we break down those choices, we have roughly 3 categorical choices we make on a daily basis. We have chemical, we have emotional, we have physical choices that we make every day. Physical choices would be like exercise as a perfect example of a physical choice. Whether you get adequate rest and sleep to recharge your body physically. That's a choice. You make a choice as to when you go to bed. Now, certainly there are things that can influence your quality of sleep or your quality of exercise, like pain or pre-existing disease. But ultimately, these things we make a choice to do. We make a conscientious effort. And so we also make a choice to not do those things, right? So again, keyword choice. Emotional, this is relationships. And this could be spiritual relationships. This could be family and loved one relationships. This could be your relationship at work, your quality of life in the job that you love or in the job that you hate, right? All of that's going to have an spiritual, emotional impact on how you think and how you feel. And then we have chemical choices. Now, chemicals are food. Think of chemical. When we say chemical, I don't just mean bad chemicals. I mean anything that you bring into your body that has the potential to alter your biochemistry, which is basically microscopically, whereas physical is choices that you make that affect you in ways you can see. This is exposures that affect you in ways you can't. So food will affect you. You don't see the vitamin C in the orange improving your immune function, but it happens and it's measurable, right? And so food can have an interaction chemically. Medication can impact us chemically. The way our food is treated, what our food is sprayed with, the processing of our food, when we add preservatives or additives or other things to it, these are all chemicals. These are all chemical influences. Food also contains things like vitamins and minerals, carbs, fats, proteins. These are nutrient chemicals that impact the way our body functions, right? So if we think about chemistry, it's things that come into our body that affects us chemically in ways that we can't see, but we can measure. And so the chemistry influences the behavior of your genetic code. Your emotional status influences the behavior of your genetic code. And your physical status influences the behavior of your genetic code. Physically speaking, if you exercise, you'll upregulate genes to increase the strength of your muscles and to increase the propensity for your muscles to generate energy. This is a genetic change that comes about as a result of a physical choice. Just like not choosing to exercise will lead to a gene downregulation that causes your muscles to shrink and reduces their efficiency at burning energy, because your body works on the premise of what you stimulate, what you choose to stimulate is what your genes pay attention to. It's what they focus on. So again, the physical, chemical, and emotional choices that we make influence the expression of our genes. So we look at the outcome, just like with the last triangle I showed you of the health industry. This physical, chemical, emotional choices influence the behavior of our DNA. And this is what we oftentimes refer to in science as phenotypic expression. To simply put it, your genes plus your choices equals you. How you feel, your energy levels, whether or not you're sick, whether or not you're healthy, your genes plus your choices manifest as who you are. So if we look at the spectrum in this scale, on the far end over here, we say there's perfection. Over here on this end is death. Now in this world that we live in, you're not dead and you're also not perfect. So it's not really realistic to be on the far end of either one of these extremes. However, we're going to be somewhere in between death and perfection. Our health, at any given moment, we're somewhere in between. Now, a lot of the people that I see in my practice come to me and they're in this, what I call, range of functional illness. Meaning, they can get up, go to work, they can still talk, they can still move, they don't feel well, they usually have multiple diagnoses, multiple autoimmune conditions, they're on multiple medications to kind of try to scrape by an existence and still function, but they're sick and they feel bad and they're not well. But they're functional. They can still go to work. on the other end of the spectrum, you have people that are well. Wellness. Now, some would say, what does that mean? What is wellness? Wellness, technically, if we want to define health, it's not the necessary absence of disease, but wealth, or rather health, is defined more as the resiliency to the stressors in your environment, meaning if your body has great adaptability and resiliency to the curveballs that life throws in your path, and generally you are well. You're capable of adapting and functioning well without having the presence of major symptoms that are hindering that function. So again, we'll call that wellness. So where do you fall in this spectrum? Everybody falls somewhere within the spectrum. Again, it's important to understand is your genes only account for 20%. So don't blame your genes. Your genes aren't a curse. Your genes are a gift. The fact that you're alive is a blessing and a gift, and your genes are going to react to these three areas. Now, if we go to a traditional medicine pathway, we're going to get chemical manipulation, right? This traditional medicine is going to strive to manipulate your symptoms, which is all fine and good if your symptoms are pain and you just need some pain relief. I'm not opposed to humanity and empathy with somebody who's in pain, but if we just strive to manipulate symptoms and we stop there, and what I mean by stopping there is chemical manipulation to affect symptoms without understanding why the symptoms exist. Because the number one question that doctors should be asking is not what drug to give you, because that outcome we have already seen is not good. But the number one symptom that the number one question doctors rather should be asking is, why do your symptoms exist? What are you doing within the confines of your choices that is leading to this aberration in how your body feels? In essence, what is disease? Disease, doctors like to give a diagnosis of a name. So it's a diagnosis of a name, the name of a disease. So they define different diseases by clusters of symptoms, right? So if we look at this from a kind of a macro level, clusters of symptoms in common patterns are what doctors are trained to recognize to diagnose disease. The purpose of diagnosing the disease has become, this wasn't always the case, historically, traditionally, the purpose of diagnosing a disease so that doctors could communicate with one another in as few words as possible, but understand the meaning of what each other are saying so that we would have better communication. But today, the purpose of getting a diagnosis and getting a name is to justify insurance coverage of the treatment. And the treatment, well, there's three main kinds of treatment in medicine. One is we use drugs to manipulate symptoms. One is physical. There could be surgery, which is a physical alteration, or something like physical therapy, or massage, or chiropractic, etc. These are all forms of physical modality treatments. And then there's, for emotional treatments, there's psychology, right? So there's talk therapy, which is fine and good, can be. But also in emotion, for treating emotional, a lot of times it's to cover the emotion with medicine. So your antidepressant meds to treat aberration of the psyche, things like antipsychotic medications, etc. So again, we look at symptom patterns turn into disease diagnoses in order to justify the insurance coverage of the treatment. The treatments are physically, surgery, physical therapy, etc., for chemical aberrations or diseases of things that we would measure chemically, like high blood sugar, high blood pressure, high cholesterol, etc. Those are drugs that manipulate symptoms, pain and inflammation. And then emotionally, we get talk therapies or we get medicines. And again, the outcome of these primary agencies in the U.S. is our life expectancy is ranked 60th. It's the third leading cause of death. We didn't talk much about surgery, and I'm not opposed to surgery when it's necessary. I think there's some fantastic life-saving surgeries, but I did want to make some commentary on surgery for you because I think context is important. So we'll pull this up from some different studies. This was out of the Lancet on the global burden of postoperative death, and you can see here the Commission on Global Surgery identified 313 million surgical procedures are performed worldwide each year. And based on this analysis, 4.2 million people worldwide die within 30 days of surgery each year. Half of these deaths occur in low or middle income families. And that's interesting because half occur in low and middle income. That means the other half has to occur in high income. So really it's kind of an equal bag. And then this number of postoperative deaths accounts for 7.7% of all deaths globally. So almost 8% of deaths globally occur within 30 days of surgery, making it the third greatest contributor to deaths globally. That's not to say there aren't surgeries that save lives. That's just simply to say that a lot of surgical procedures don't come without risk. And then this one is published by the WHO. You can see here complications after inpatient operations occur in up to 25% of patients. So I mean, a lot of times when you go into surgery, you have to sign these huge waivers, these what are called informed consent forms to validate that you understand that there's a tremendous risk for having an operation. Again, complications occur in 25% of patients. In industrialized countries, nearly half of all adverse events in hospitalized patients are related to surgical care. At least half of the cases in which surgery led to harm are considered preventable. So this goes back to what I was saying, again, my own personal anecdote experience of the doctor in the hospital who did not pay attention to detail, who did not initially do an exam, who did not initially do a patient history or have a conversation with the patient and just wanted to perform procedures. It's a lack of attention to detail, and it's a lack of empathy, it's a lack of caring. And I think we're in a system that promotes those things because those things are profitable. All that being said, going back to our list here, if we've got physical treatments, surgery, again, third leading cause of potential death in the world, but it's a major form of treatment. And that's not, again, not to say that all surgeries are bad and that if you're faced with a surgery, you should absolutely turn it down for fear of risk. You have to weigh the risk, the benefit. You have to go back to what's the outcome with the surgery, what's the outcome without it, and what are the risks in doing it. And you have to be able to make an intelligent decision for yourself as to whether or not it's the right move for you to make. But at the end of the day, why are you in a situation that requires surgery? If it's not some type of accident or trauma or wound, what puts you in that situation in the first place? You know, heart surgeries and other types of surgeries for pain, like spinal surgeries or muscular surgeries, because somebody hasn't done their part. Somebody has made the wrong choice physically, or made the wrong choice about their food chemically, or made the wrong choice about their relationships emotionally. And so making so many different wrong choices in their primary areas of choosing has led to an expression of functional illness, which leads to today's medical intervention. That's where medical intervention, generally speaking, people who feel well are not lining up at doctor's offices to get advice. It's the people over here. And so it's this medical intervention that we've been talking about that people seek out. But if the medical intervention that people seek out is not really actually doing a fantastic job of helping these people overcome and get better, we have to start thinking about it differently. So what are your choices that you could make every day? You have chemical choices. Let's define a lot of these chemical choices in terms of where you should think about starting. Number one, eat real food. Quit eating chemicals and calling it food. Quit socially justifying crap to put in your mouth because everyone else does. You know, your parents probably said this to you. Everybody's probably heard this cliche. If everybody was doing it, does that make it right? If your friends are all doing it, if they were all jumping off of a cliff, does that make it okay for you to jump off of a cliff? But we have jumped off a proverbial cliff in terms of what we call food in this country. And this is a huge part of our problem because food is what creates the chemical inflammation that drives the genetic expression into disease state in the first place. So food, we can start here by eating real food. Number two, we can drink clean water. Your body is 65 to 70% water. If you're drinking water contaminated with chlorine and fluoride and other antibiotic-based chemicals, you're not doing yourself any favor chemically. We can also look at air pollution and clean air as an option. So filter your air. You're not going to escape living in cities. Now, we can, as a community, as a social community, as the United States, we can develop more clean air initiatives and we can develop more policy around how to make this cleaner. And we can use that influence over our governmental bodies to potentially help us. But at the end of the day, to act fast, to do something now, filter the air in your home. So you can filter your air, you can filter your water, you can eat real food. These are all empowering things that you can do today. Additionally, what can you do here chemically? Well, you can look at your medication list and you can have a conversation with your doctor about these things. How can I eat? How can I clean up my environment so that potentially the chemicals I'm being exposed to through my own choices are not making my body sick, that's requiring me to medicate my symptoms away? And something else that is very common here, how many of you have ever gone to a store or gone to the mall and you have all these chemical aromas wafting through the air? And you know, classic example here, there's several stores that have like a trademark aroma that they're pumping into their HVAC systems or their air ducts so that every store, no matter what state you're in, no matter what city you're in, smells exactly the same. Look, classic examples of these at home are like the air plug-ins, these little things you plug into the wall that heat up and they emit these toxic compounds, these volatile organic compounds into the air to mask the symptoms of an unkempt home. These are bad news, folks. This is why so many people are reacting, because you know we get exposure to data about 60,000 different chemicals that historically we weren't being exposed to. And so clean that garbage out. Those things, again, these have all been normalized. Unreal food, we've normalized as real food. We've normalized pollution to a certain extent. We've normalized adding chemicals to water for the sake of cleaning it to a certain extent. And we've normalized the use of a ton of environmentally unsafe and human unsafe toxic compounds to clean our houses and to make our houses smell better. And so you're basically being bathed in chemical soup. And when your health fails, you're running over here to mask your body's warning signs. Your body's just trying to tell you, stop it, do it differently. And then you're medicating the symptoms away and you're ignoring them. So these are things you can do right now. You can get all this garbage out of your life, and you can normalize this so that the people in your family and the people that are in your close inner circles are doing it too. So that now, if everyone's doing it together and we're all approaching this at the same time, if we're clean eating and we're clean living, then it becomes the new standard. Right now, it's not the standard at all. Most people completely ignore this. And unfortunately, doctors, the vast majority of them completely ignore this. If you ask a doctor, is my disease have anything to do with food or diet? The simple answer they're going to give you is, oh no, diet has nothing to do with your disease. It's not true, but that's the answer that you're given. Now, when it comes to physical choices, make the choice to move. Get up, move, even if you're in pain. Movement is one of the primary treatments of pain, right? Physical therapy, good chiropractic care is one of the treatments for physical pain. And when you quit moving because you hurt more. This is the feedback loop. The more you fail to move, the more your body deteriorates. Use it or lose it, in essence. So move. Just encourage more movement. If you work at a desk, consider a treadmill, a desk treadmill. Consider setting an alarm to take breaks, but get physically active and move. I mean, this is, in my experience, this is probably one of the most under-recognized causes of chronic illness. And then, there's the emotional component. Make good decisions about relationships, and that's a tough one. Some people are more emotionally intelligent than others. Not everybody thinks the same. Not everybody was raised the same. But you should ideally be aligning yourself with other people who think these ways with you. Because if you are married to a person who believes that air fresheners are healthy for your children, and you're in an argument over that, then you're going to have a bad relationship. If you're in a relationship with a person who believes that eating Taco Bell every night is healthy and good for your children, you're going to have problems in that relationship, and it's going to create a huge emotional rift in your life. If you go to a job every day that you absolutely hate, it's going to create a huge emotional rift in your life. So you have to be selective of the people that you choose to be around. That doesn't mean you can't be a fan of people. It just means you have to be a fan of you and protecting your own emotional kind of status by having good choices around your relationships. So these are things that you can take away and you can start doing now. When people come to see me in my practice, we always start with questions around their physical activity, around their emotional state, also around their chemical choices. And we measure these. Remember I said earlier, these are measurable. You've heard me say this over and over and over again. If you've watched my show for any length of time, you've heard me say there are 4 fundamental categories of triggers for chronic inflammation. What are they? Food, environmental chemical exposures, including the chemicals in our food, microbes or microbial imbalances, because we're exposed to so many different types of antibiotics and the chemicals in our food and the chemicals in our environment. It's had tremendous impact on the diversity of the bacteria that live inside of our GI tracts, and these bacteria help us make vitamins, help us digest our food, help regulate our immune system functionality, and it can be measured. And then the 4th category is nutrients, vitamin and mineral deficiencies. These things can be measured. They're simple to measure. And they can allow for a person to have customization in their health care. You want to know what you're doing wrong and it's not obvious? Now, hopefully, before you spend money, getting testing done, hopefully you start with common sense. Eat real food. Don't expose yourself to a bunch of unnecessary chemicals. Start moving. Go outside, get good sunshine, get good sleep, drink clean water, breathe clean air, have healthy, emotionally sound relationships. Do those things. If you're still sick and you're still struggling, now this can be measured and you can get customized health information that allows you to make intelligent decisions. Because remember, don't forget, all of these things are choice. They're decisions you get to make every day. And making a decision sometimes is choosing not to do something as much as it's choosing to do something. So you make decisions every day in these 3 areas. As I've been saying, these 3 areas are going to influence the phenotypic expression of your DNA, which is going to be a manifestation of whether or not you're sick or whether you're healthy. And if you're sick, how much quality of life are you having? And if you're sick, you're usually seeking out medical care. But if you go back to the medical care we've been talking about tonight, you're seeking out the medical care that's the 3rd leading cause of death in the United States, but responsible for $4.7 trillion in losses. And the only people that really profit in that system are the people who are earning a living or making a living off of you being sick. So if you're tired of that system, adopt a new philosophy. This is the philosophy that you should have, is that you get to make decisions physically, chemically, emotionally every single day. Start thinking about how you're making those decisions. Start changing the way you think about and the way you embark upon having those decisions in your life, and you're going to see tremendous outcomes in your health. And if you're looking for a doctor and you're trying to ascertain what kind of doctor you should see, you should be looking for a doctor who understands this philosophy and is moving away from the antiquated philosophy of treat symptoms with drugs, surgery, as an outcome. Those have failed us, and we are a very miserably unhealthy society, and that poor health affects the way we think. It affects the way we view the world. It affects the way we experience the world. It affects our relationships in the world. It affects everything that we do. And if you look around in today's world, there's turmoil everywhere. There's bipolarism everywhere. There are people at each other's throats, not so much because we hate each other, but because we're sick and we feel unwell, because we've been told to make decisions that don't make any sense, and we're making them, and we're continuing to perpetuate this chronicity of inflammation. Remember, inflammation affects your thoughts, it affects your emotions, it affects you physically, it affects you chemically, and if you don't start taking common sense and start taking your own choices in your own hands, you're never going to find an answer in a pill or in a surgery or in somebody else's half-cocked advice. You have to be in charge of your own health, and the only way you're going to do that is to make better decisions. And if you reach a point where you've made great decisions and you're still struggling, now you know what to measure. And now you can customize your own journey, because there is no such thing as one size fits all. It doesn't exist. If it worked, we wouldn't spend $4 trillion a year and kill more people every year as a result of spending that money. So hopefully you've taken this to heart. Hopefully it's been helpful for you to understand philosophically how to better find a doctor. In essence, when you're interviewing doctors, if they're not thinking along this line, if they're thinking medicate symptoms away instead of working as a partner with you to customize your wellness journey based on objective measurements that help you make better decisions about your physical, emotional, and chemical behaviors, then probably you're in the wrong room. And if you're already struggling, you probably have been in the wrong room for a really long time. So I hope this was helpful, and I hope you can use it as you navigate your decisions around your healthcare and trying to find professionals to work with. Thanks so much for tuning in to Dr. Osborne Zone. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.